When dealing with a highly sensitive autistic child, how are you able to tell the difference between a reaction and a detox symptom?
Good question. In a child that's on the autism spectrum, can you observe and tell the difference between a delayed allergy, a toxic reaction, and just an emotional spill? Observation is your friend. Each of these children is unique. Yes, I believe that parents become Dr. Mom and Dr. Dad to these children, and that parents are the best observers to know when the behavior is out of control, immunologically, biochemically out of control, and when the behavior is just a child being a child. Sometimes they smile and sometimes they have hissy fits. Again, our diagnostic criteria are not very precise. The observer makes the determination, the professional or the parents together make the determination. And then what do? Well, you take the problem of the child apart and you see, oh, is this something that happens after certain foods? Do the LRA test. Is this something that happens at certain times of day? Well, think about the circadian rhythms and what might be up or down at that time of day, and maybe some biochemical individuality is being expressed. So I am slow to apply a label or a diagnosis. I do think that functional tools and just knowing that individual. How do you know whether a child, a younger child, a pre-verbal child, how do you know when they're having colic, which means something in their belly doesn't feel good, from some other reason why they have a spasm in their intestines, which could be a medical problem or just something that will pass? So what I'm saying is that the parents are the keenest observers of the child's behavior. And when the parents become educated through groups like Project Hope, they are the ones who I rely upon to say, this is a typical child's meltdown of the moment, and they'll be fine, in a few hours, versus, gosh, this is something recurrent. This is something that is abnormal in the sense of, gosh, we wish it wasn't here functionally. And that's the time to get in with functional predictive testing, predictive biomarker tests, to get in with a specialist in neurodevelopment and see whether this is individuality, just variance, among children, or whether this is something that is a cry for help, and we approach that physiologically and biochemically rather than pharmacally.